Do you or someone you know suffer with eustachian tube dysfunction? Over here we have a normal eustachian tube, and over here we have a blocked one. Now, oftentimes, two muscles that are involved when people have a blockage to their eustachian tube are the tensor veli palatini muscle and the tensor tympani muscle. When those muscles have been irritated or there's inflammation, sometimes they lock down and they tighten everything up, and it makes it to where you can't drain the fluid out of your ears properly. In addition to that, oftentimes it changes how well people can clear their ears when they rise or lower in elevation, kind of like when you're on a flight. And it keeps you from being able to hear properly because now you don't have the same amount of room that you normally would have. Now, what happens in the case of a lot of people is that if you've been to the ENT and you've had all their tests done and they really can't figure out what's causing this lockdown effect of your eustachian tube, then it might have something to do with your upper neck. When these top two bones misalign and lock out of place, it can cause irritation to the central nervous system, and that irritation makes its way forward and sometimes has an effect on the inner ear. Now, when their inner ear is affected, there's a number of different things that can take place. For some people, it's tinnitus. For other people, it's vertigo. And then in some cases, it's eustachian tube dysfunction, or it might be some combination of all of them altogether. Now, the good news is Upper Cervical Chiropractic can help. We are Neckwise Salt Lake City. We're doing a free consultation. We'd love to get you into the office, get to know you a little bit, find out what's going on with these bones up here, and get you back on the road to health and healing today.